My name is Dr. Beatrice Kiage, the Leader Health Ministry this year, and I'm here to promote the free medical camps that we're going to have the whole of this week, starting from tomorrow, Sunday, from 9 o'clock all the way up to Thursday. We are privileged as a church to have service providers who are giving us free services. If you went to Nairobi Hospital here or any other, clinic or anything like that, there's no way you are going to be given free services. But we are privileged to have people who have offered themselves to give us free services this week, because as we are trying to nourish our spirit, also we have to be checked to find out whether our bodies are also healthy. So I'm here to encourage you to please come in big numbers to utilize these activities. You're going to have Gertrude here with us. We're going to have AR. We're going to have Buruburu Dental. And we have the University of Nairobi, who are going to look at the elderly. What do I mean by the elderly? If you are in this congregation or you're listening to me online and you're between the age of 60 and 70, you fall in this category. We are not calling you an oldie, but we also need to take care of you. We have noticed that this is the group which is always left out. So we are taking care of your needs this week also. Please come on Tuesday, because the people who fall under this age bracket are being taken care of on Tuesday. Please make sure you come early enough so that you can be able to be seen and you can be assisted. And this afternoon, we have Dr. Julliet Onyango, who is handling dental health. She'll introduce herself. She will tell you exactly what they're going to do this week here, and I'm sure she has a lot that you're going to learn from. Thank you very much. Karibu sana daktari.
Praise God. Praise God once again. Okay, my name is Dr. Julliet Onyango. I'm an oral health officer from Buruburu Dental Center. We have 3 major branches, one in CBD along Ronald Ngala, the new building, the Nairobi City Center, and we have another branch in Buruburu, Vision Plaza. It's at Buruburu Shopping Center. And then there's another one in Machakos. So today I'll want to educate you more about your dental health and how you can maintain a good dental health. And hopefully I'll impact some knowledge. So, So we'll talk about 3 major things, and the first one is the enemies of the teeth. So what are the enemies of the teeth? So there's one, the first point is what you call plaque. So what happens when you eat or when you are eating? There's this thin layer that forms around your teeth. That's what we call plaque. So we always advise that after what happens is when the plaque forms around your teeth, food particles will stick to that plaque. So if you don't brush, bacteria will start acting on it, on the plaque. And then sooner or later, you'll start developing some cavities. So plaque is an enemy of the teeth. 2, we have sugars. Sugars, especially sweets, chocolates, anything sugary, again, it's an enemy of the teeth. So we always advise, if you have to take sugars, at least minimize them as much as possible. And then also we have what you call gum infection. Most of the time you'll hear people say my gums are bleeding, or when I brush, I feel as if, or I see blood on my toothpaste. Again, that's a sign of gum disease. So in case you've had maybe somebody complain maybe of gum bleeding or gum infection, again, that's a sign of gum disease. So we'll advise them to at least see a dentist as soon as possible. And then also we have cavities. Cavities is just, in layman's language, it's a hole. Most people will say, or will come to you and tell you, I have a hole on my tooth. That's what you call a dental cavity. So in case you have a cavity or a hole, in quotes, it's advisable you see a doctor, a dentist, as soon as possible. Okay, so what happens when you don't brush nicely, or what are the effects of poor oral health? So if you don't maintain your teeth, that is, if you don't brush nicely, if you don't floss, what are the effects? So I'll just highlight some of them. I won't go through the details. So the first is discomfort. Yeah, so the discomfort can come about, especially if you have cavities again, you'll have some discomfort, especially while chewing, or even just taking anything hot or cold, there'll be some discomfort. And then also, effects of poor oral health, another is you have poor social relationships. This will come about, maybe you'll have what you call halitosis or bad breath. And definitely that will affect your social relationships. And then also low self-esteem. Again, if you have maybe the halitosis, of course you'll have the low self-esteem, which will again affect your social relationships. And then also effects of another poor oral health is speaking problems. That is, if maybe you end up losing one or two teeth, you might end up also having difficulty pronouncing some words. So that's why we advise you at least see a dentist. Even if it's twice in a year, it's advisable so that we may be able to pick something or anything developing early enough. So when to visit the dentist? So when are you supposed to visit the dentist? One, if you have swollen gums. If you notice your gums are swollen or red, we always advise make sure you see a dentist. Two, if you have what you call bad breath, we also advise you at least see a dentist so that you can see the cause of the problem, where the bad breath is coming from. And then if you also have a toothache also, of course, if you have a toothache, I'm so sure the first thing you will do is see a dentist, because a toothache, it's not something that you'll be able to unaweza assume useme ati wacha nikae labda itapona. I'm so sure if you have a toothache, you will just rush to the dentist. Again, if you have a loose tooth, of course, or loose teeth, the causes are so many. But in case you notice maybe one or multiple of your teeth are loose, we always advise you see a dentist as soon as possible. And then again, when do you visit a dentist? Again, if you have difficult chewing. Yes, it might be a sign of an infection. Maybe one or two of your teeth have an infection, and the infection might spread even to your throat, and then you might end up with difficulty chewing. So we always advise, if you have also or you experience difficulty chewing, it's good you also see a dentist. And then also if you have extreme sensitivity to anything hot or cold, again, we always advise you see a dentist. Again, it could be due to so many reasons, which I don't think I'll go deep into them. But in case you notice that when you're taking anything hot, it could be anything, maybe an ice cream or anything, anything cold like an ice cream or anything hot, maybe hot tea or something, you feel as if there is some sensitivity or you're experiencing some sensitivity, it's always advisable you visit a dentist as soon as possible. Yeah, so my presentation wasn't that long. Yeah, so the only thing I'll want to show you is how to brush, because some of us, okay, it seems like a basic thing, but most of us will find that they're not brushing well. So I'll demonstrate on how we are supposed to brush, and after that, I'll be done with the presentation. Yeah, so. So this is a model of how our teeth looks like. So I'll just demonstrate how we are supposed to brush. Thank you. Yeah, so this is how our teeth looks like. So you'll just hold your toothbrush. You can start with either jaw, either the lower or the upper. So you're supposed to brush in a circular motion. Most of us brush like this. But that's the wrong way of brushing. We are supposed to brush in a circular. Mnaona? Yeah, like this, gently. If you brush like this, what happens is you're putting too much pressure on the gums. So with time, you will start noticing that your gums are either going downwards, what you call gum recession, and with time, you'll start experiencing the teeth sensitivity because, again, your gums have been affected. So we always advise you brush in a circular motion and gently. Okay? You do that on your upper jaw and then again on your lower jaw in a circular motion. Yeah, for at least 2 minutes. 2 minutes is enough for both the upper and the lower jaw. And then also the tongue. How we are supposed to brush the tongue, you just from the inside going outwards. Yeah, so you brush like this. Yeah. Okay, so that's the end of my presentation, and I would want to take this opportunity to give, at least if there is anyone who have a question or a comment or maybe you want to add something, I think you are free to ask. Yes. There's one. I think there's someone who wants to ask a question.
I realize that most of us brush in the morning. After eating at night, you sleep like that, but in the morning, you brush after the food has done the work in the mouth. So when is the right time to brush?
Okay, thank you so much. Yeah, so when is the right time to brush? That's a very good question. So we always advise you brush twice. One is in the morning after taking your breakfast. Most of us brush before immediately they wake up, they brush, and then they take their breakfast. You're supposed to brush, most of us first brush, and then they take their breakfast. You're supposed to first take your breakfast, then you brush. And then again, you're supposed to brush in the evening before you go to sleep. You're supposed again to brush. Because again, in the evening, that's when you'll find that most cavities develop, because again, you are asleep. There are not so much activities going on. You are not talking. So you are asleep. So we always advise before you go to sleep, make sure you brush. So you're supposed to brush twice. In the morning, after taking your breakfast, and in the evening before you go to sleep. Make sure you brush. Actually, in the evening is very important. Most of us, I'm so sure, maybe we assume or we forget, but at least as from today, make sure you brush twice. Thank you. Any other question?
A follow-up on the demonstration how to brush. I didn't see you get inside. Do we need to brush inside the teeth, or it's just okay to do it outside?
Oh, yes. You're supposed to brush outside and inside. Yes. So make sure you brush on the outer surface and again on the inner side. Yes. I demonstrate. Oh, okay. Yeah, so again, I had shown you how to brush on the outer surface. Again, you just brush in a circular motion, gently. And then also on the inner surface, you can also brush. Okay, you can either brush like this, or you can brush from the inside going outside, like that. I don't know if you are seeing. Or also in a circular motion, which is still okay. Especially for those people who have what you call gum recession. For those their gums are a bit, they have receded. Ni kama zimesonga chini. We always advise you brush this way. Hata kama ni nje, una brush hivi. So that you don't again end up pushing too much pressure on the gums. But if you have healthy gums, we always advise you brush in a circular motion. It's the best way to brush. Just in a circular motion, very gently, for around 2 minutes. 1 minute on the upper jaw, and then another minute on the lower jaw. And then also remember to brush the tongue. Any other question? Yes.
Okay, so mine is just to ask on the kind of toothpaste to use, because I read a research on fluoride toothpaste, that fluoride is actually harmful to our teeth, and that they will talk more of using salt and maybe charcoal, something like that, because nowadays you see a lot of toothpaste have the fluoride and something. So I just wanted to ask, which should be recommended? Or if the research was wrong, so you can also answer that. So thank you.
So which is the best toothpaste to use? That's what you're asking.
Yeah, that is recommended, because I just had that research that talking about fluoride toothpaste is actually harmful to our teeth than what is actually being advertised and marketed. So if you would just clarify on that.
Okay.
Cool.
Yeah, so we always advise you use a fluoridated toothpaste. And again, yes, fluoride, it cuts both ways. If it is too much again, if the fluorides are too much, they'll end up affecting your teeth. But again, with the toothpaste, the fluorides levels, the levels are very, very minimal. So they won't affect your teeth. Because again, fluoride is very important in the formation of your teeth. Yeah, they strengthen the bones. So fluoride, it cuts both ways. If it is used within within what we call if it is not above the ranges that we advise, it's okay. But if it is above what we always advise, again, it can cause so much harm. But with the toothpaste, the levels are okay. So you can just continue using the fluoridated toothpaste. Yes. So fluorides, it's okay. Fluorides are okay. But again, if they are too much, that's when they'll affect your teeth. Especially if maybe you are exposed in areas where the fluorides levels, especially in the water, they are so high. That's when you'll notice, maybe some of you, maybe especially with children, you'll notice their teeth are changing. They're changing to brown because, again, the fluorides levels are very high. Yeah, but if they are within the normal ranges, they are okay. Especially in toothpaste, it's within the normal ranges. So it's okay. You use a fluoridated toothpaste to brush. And again, we always say it's not the type of toothpaste you're using that is very important, but how you are brushing is what is very important. Because you might go get the best toothpaste, but you're not brushing well. So in the long run, you still maybe have or start experiencing dental issues. Yeah, so I think I've answered your question. Any other question? Yes.
I wanted to inquire about these young kids who are yet to, their milk teeth are yet to come off, but you find that we call them shark tooth, that grow inside the milk teeth. So what could be the problem of this shark tooth growing, yet the milk teeth is yet to come off? And what could be the solution to this problem? Because I have a kid who already has, the milk teeth are not yet off, but there's one that is coming, growing from inside. And what is the solution for that?
Thank you. Yeah, so what happens is we have two sets of teeth. The first set is the milk teeth. They are the first teeth to come out. They'll come out at around 6 months. Some will delay to around 9 months, but they're always the first teeth to erupt. So by the time a child is around 2.5 to 3 years, they have all their milk teeth. So what happens is, and then again we have the other set, which is the permanent teeth. So at around 5 years, the milk teeth, they'll start shedding. And then what happens is the permanent, they'll take that space. So what happens sometimes, there's what we call delayed eruption. Sometimes the permanent teeth are trying to come out, but the milk ones are not shaking. They are very firm. And you see that milk teeth, it's supposed to come out so that the permanent one takes that position. So once it doesn't, once the milk teeth is still in that place, what happens is the permanent, it gets confused because now it doesn't have any space to take up. So what happens is they'll start growing either on the inside, you start noticing maybe there are other teeth coming out inside the child's mouth. Now those are the permanent teeth that are trying to come out. So what we always advise is the moment you see another tooth trying to come out, what you always advise is you take the child to the dentist and we'll remove the milk ones. Once we remove the milk teeth, now the permanent teeth will have space. So what happens is they'll take that space. But the moment they are not removed, once ukibaki na hiyo meno hapo, the milk teeth, if you stay with them, then the permanent ones will continue growing in the wrong position. So we always advise, once you notice that the other set of teeth, which is now the permanent teeth, are trying to push their way, it means that the milk teeth are still there and they are occupying that space. Zimechukua hiyo nafasi ya permanent teeth, because they're supposed to be out so that the permanent ones take that space. But when they are still there, now the permanent, they get confused because now they don't know which route to go. So they'll start growing either inside, or even sometimes they can even come outside. So the moment you notice, the best advice is just take the child to the dentist. They'll remove the milk ones, the milk teeth. We create space for the permanent teeth. Thank you. Any other question?
Hello. Yes, thank you, Dr. Julliet. I have two questions, probably. One is, how often do I have to change my toothbrush? The second one, what can you say about, we've been advised out there to use charcoal, as the previous speaker said. How good is charcoal? And some say soda bicarb during teeth whitening. Are they safe to be used? Thank you.
Okay, thank you so much. So the first question was, how often are we supposed to change our toothbrush? So we always advise after 3 months, you change your toothbrush. And then again, if you had maybe a viral infection like a flu, we always again advise you change your toothbrush, because sometimes the bacteria might still remain inside the toothbrush. So we always advise, in case you've had a flu, it's always advised you again change your toothbrush. Even if it's not, maybe it's umemaliza nayo 3 months, it's good you change it. And then again, ideally after 3 months, just change your toothbrush. And then about charcoal, is it very effective for whitening your teeth? Okay, it's a controversial topic. Okay, charcoal has what you call some basic properties. And okay, there's some research that have proved that charcoal whitens. But again, it's still controversial. So we can't really say that it's 100% effective, that when you use charcoal, it will whiten your teeth. But it is, okay, some research have shown that it might, but I think the results are very minimal. Yeah, so yes, you can try using the charcoal, but I don't think you will see if the results are maybe what you had expected. Maybe you had expected your teeth to be very white. I don't think the results will be that satisfying. But again, we do what you call, especially inside a dental unit or when you visit a dental clinic, there's what you call professional teeth whitening. So if maybe you wanted your teeth to be white, we'll always advise you to visit a dentist, and then we'll do the professional teeth whitening inside our dental clinics. It's the safest, and of course, we guarantee 100% results. Thank you. Any other question?
Happy Sabbath. Happy day. I have 2 questions. The first one is it advisable to coat your tooth one has a cavity? And the other one?
Sorry?
I'm asking, is it advisable to coat, or rather to fill, your tooth once it has a cavity? And also, is it okay to coat, or rather put those artificial teeth? What are the effects?
To coat. When you mean coating, do you mean like a filling? To put a filling on a tooth? Okay. Yes. We always advise, especially in this age and error. We don't advise you remove, unless you remove your teeth, unless now it's beyond being saved. That's when we remove them. But if there's anything or there's something that can be done, we always advise you go for that option. Yes, teeth fillings are very effective, and they'll serve you. They'll serve you for the longest time. For some, even they have stayed with teeth fillings for even 20 years, 28 years. So we always advise, especially if it is a very small cavity. I don't see any need of you removing that tooth, yet it can be saved. And again, even if we do the filling, once we do the filling, you'll still be able to use that tooth. You'll be able to chew with it, and then there'll be no effects. You won't have any, maybe if the tooth was sensitive, the sensitivity will no longer be there. So we always advise, try as much as possible to save your teeth. Unless now there is nothing that can be done, that's when we advise you remove them. But before we go to the option of removal, we look for other options before we decide to remove your teeth. So yes, I'll advise, fill, save, try to preserve your teeth. Yeah, so if it is a filling, go for it. Yes.
All right, happy Shabbat. Now, on the issue of toothpaste, when we want to brush, what is the quantity we put on our brushes, especially if the children or for adults? How do we measure how to put the toothpaste on the brush so that it's not, we try to minimize the chloride issue that you talked about?
Okay, thank you. Yeah, so the amount, okay, if it is children, especially below 5 years, we always advise you put a pea size. Kidogo sana, you just put very little. Because again, that's, you see, between the ages of 0 to 12 years, that's when children are exposed, or they are more prone to get fluorosis. But after 12 years, their teeth have already developed. And again, the amount of fluorides in the toothpaste, they are very minimal. So it's very rare that they'll end up having fluorosis because of maybe because of they used maybe the toothpaste, yeah, maybe the fluoridated toothpaste. So we always advise, if it is a child, again, if it is below 5 years, just put a pea size on their toothbrush. If it is an adult, it can go just along the bristles. That's enough. Yes. Thank you.
Check. There are two questions from people watching online. Ellen? There are two questions from people watching online.
Yes.
One is...
sorry, I'm thinking that she's the one.
Araf, could you tell them a rough estimate of implants? Then the second question is, what happens when you remove your tooth? Is it okay to leave it that way, or is it advisable to fill?
Okay.
Thank you.
Thank you so much. Yeah, so an implant, okay, what is an implant? Okay, what happens is when, in case of 1 or 2 reasons, you end up removing your tooth. So there is a gap there. The tooth was removed, so you've remained with a gap. And you want that gap to be filled. You don't want that space to be there because sometimes you might have difficulty chewing, so you want that gap to be replaced with another tooth. There are so many options to do a tooth replacement. We have the removable ones, we have the permanent ones, and also we have the implants. So what happens with an implant is we drill it's a permanent, it's a form of permanent replacement. So we drill the bone, there is a support we put, and then we put another tooth there. So it's more of a surgical procedure. It might take a bit longer to heal compared to the other options. Yeah, so that's what we call an implant. We implant another tooth, and it's a permanent solution. So it's about 180,000 to 200,000 for an implant. Yes, and then there are also other options. We have the removable dentures or the removable teeth, the ones you can remove, you can place them back. And then we also have another, what you call a crown and a bridge. It's also a form of, if you want your tooth or teeth to be replaced, there's also another option known as the crown and a bridge. Yeah, and yes, we always advise, once you've had your tooth removed, make sure you get another one replaced. You replace another tooth. Because what happens is, if you leave that space, what happens is the other teeth will start shifting towards that space. So with time, you'll start having some discomfort, especially while chewing, or even the jaw. The jaw will start having some pain, what you call jaw pain. So we always advise, once you've had your tooth or your teeth removed, make sure you replace them. Don't stay with a gap, because even chewing alone will be very difficult, because chewing with a gap, you can imagine you have a gap, there's maybe you're missing 2 or 3, of course you'll have difficulty chewing. So we always advise, if you have maybe 2 or 3, just have them replaced, so that at least you'll be able to chew well, and then also we'll avoid other problems in the future, like the jaw pain, the teeth they'll start shifting, because you see now there's a space. So the teeth, what happens is they'll start shifting towards that space. Yeah. Thank you. Any other question? Yes, there's...
What causes gum recession? What are the effects? And is there a cure for it?
Okay. Thank you so much. So what are the causes of gum recession? Okay, the major cause. One, again, gum recession is a normal physiological process. As we grow older, our gums tend to recede. So you will notice, especially people after 60, 70 years, most of them will have gum recession. It's just a normal physiological process. It happens to almost all of us. As we get older, also our gums tend to recede. But again, there are other causes like the tooth brushing. If you are not brushing correctly, again, you might end up having gum recession. Because if you're not brushing in a circular motion, the way, sisi tuna brush, yeah, if you brush like that, with time, the gums, because you're putting too much pressure on the gums, so with time, they'll start receding slowly. Again, gum problems is a very slow process. By the time now you are maybe feeling the effects, it's something that started a long time ago. Yeah, so that's why we always again advise, visit our dentist at least twice in a year, so that at least we'll be able to pick up if there's anything, or we notice there's anything, we'll be able to pick it up earlier and also deal with it early. Yeah, so gum problems it's a chronic, they're mostly chronic issues. It's something that started slowly, but it's progressing very slowly. So by the time you are feeling the effect, already the damage has been done. Yeah, so we always advise again, just visit a dentist, and I think they'll be able to sort the issue earlier before it progresses. Thank you. Okay, so thank you so much. Thank you so much for your time. Nashukuru sana. I don't take it for granted. I know some of you had maybe so many things maybe they were supposed to do, but you chose to be here. Nashukuru sana na mbarikiwe.